ADBN, Advocate Broadcasting Network. Work.
Hello and a beautiful new week to you. I am Nancy Banigo and this is Softline. And today I have with me Eddie Diong. Eddie Diong, how are you?
I'm fine, Nancy, and you?
I'm fine, thank you. It's been a while. I had to be a little bit dramatic with your name this afternoon.
As usual. I thought you would come back repentant, but you haven't. But hold it there. Let me say something to my viewers out there. Hello, everyone. It's a beautiful Monday, and it's always nice having you on and out there watching us on ADBN TV. And the program is Softline. Remember, I would always encourage you to follow us on our social media handle, the Facebook and the YouTube. Today, we're going to come your way with something interesting as usual. I keep telling you, this is a program you shouldn't miss for anything.
All right, Eddie.
Happy viewing.
I hope you're doing great. Well, I don't even need to ask. It's as if Nigeria is not doing you. You're looking good.
Thank
God for you.
Thank you.
Thank God for you. Because I don't want you, we are fond of always complaining when we're being complimented.
Nobody's complaining.
Somebody will say, you look good. This is saying thank you. So are you sure I am actually looking good? But
I know. Thank you.
I saw something today, Eddie, that I think we should talk about.
Okay.
I went to drop off my kids at school today, and I saw a parent, putting on bum shorts. And this is not the first time I'm saying it, but I think what's made it different this morning was my son had to ask me, Mom, why is she wearing such a thing to the school? I felt so embarrassed. I just pretended as if I didn't hear him. Because at that point, I was so pissed. I didn't even know what to say to him. So I don't know why parents are beginning to... it's like a trending thing for parents now, wanting to wear exposing outfits to go pick up their children in school. I even had to go check.
Irrelevant trend.
I tell you, I even had to go Google, to find out how a parent should dress to go pick up their kids from school. And all the pictures I saw were decent pictures. I didn't see anything like bum short, wearing things you're supposed to wear to the beach to come pick up your child at school.
Exactly.
I don't know.
Where do we start from? And what do we actually have to say here? It has to do with the individual, and it's sickening. Sometimes I know I've had to be harassed or insulted in an attempt to draw the attention of one of those people. Like, look, this is not right. If you're doing this, what advice will you give to your child, So, I don't know.
I actually tried talking to one parent one time, the beginning of the term. I went to pick up my kids in the afternoon, and she was wearing something. She was coming out from her car, and I was also coming out from my car. So we were one-on-one. So I had to why are you wearing this kind of a thing this hot afternoon? Oh, sorry. She was so sorry that she said, I just came out from the room. It was time to come pick them, so I had to rush.
That's not an excuse.
She made it look as if it was a one-off thing. But no, I have seen her, after that encounter with her, I've seen her 3 times wearing similar kind of clothes.
Okay, I don't know. I think we will have to keep addressing such. And then for those who take it in good faith, fine. For those who don't, because some of them I want to say maybe they don't seem to actually understand the impact or know that they don't have to dress that way out. Why do I say so? Because some of them, when you approach them, they would apologize and then change. But I'm surprised, in this case, after giving you such a flimsy excuse, she didn't change. So maybe she was just being a little bit civil, she didn't want to rub it off. Yeah, so at least we thank God that she wasn't that.
Do you think schools should begin to, impose
yes,
some kind of dressing?
Exactly. If it gets to that level, schools should put up measures, embarrass them at the entrance. Embarrass them. If they need to walk into the school, they stop them from coming in. Except that in their car, then fine. But as long as you step out of your car into the school environment, you shouldn't be addressed, you shouldn't be allowed in. Yes.
I think that's the way to go, because by the time school begin to take responsibility for this, I think most of these parents they'll sit up,
Since they don't want to address themselves, they don't want to learn, they don't want to be responsible, they could be forced to be, and that the school would help in doing that. I think, like you just suggested, it would be a better way to suggest it during PTA.
Exactly.
That this is it. But I know I have had a school who sent us on a platform. Yeah, like one of my school. Yeah, they sent it on the parents' platform during visiting days, because it also happens on visiting days, not just dropping and picking up. They come, and I don't know what it's always on their mind when you go to a school environment. You meet with children who are supposed to look up to you, and these are the same children you would want to advise not to dress indecently.
I'm telling you,
and
so
you're modeling. Yeah, this indecency. So what do you expect?
What do you even tell them?
Exactly?
And now these children begin to see that if our parents dress like that, then this is how to dress, especially the girl child. Look, just imagine the girl child looking at that parent, or even she had daughters.
So
what would you tell them?
I was about coming to that. So you imagine the kind of child she would raise, because if you as a mother do not know how to dress, and the appropriate dressing, and at the right time and the right places. Nobody is saying you shouldn't wear bomb shorts.
We have places for them.
Exactly.
You have places for them.
Exactly. Wear appropriate dresses for the right places, not, being a misfit, wearing what you should wear for the beach or a night party to a school in a broad daylight.
I think it's high time we start looking into some of these issues. I was so embarrassed today, as in I could not even answer my son. I just pretended like I didn't hear the question, because I didn't even know what to say.
I know how such a question could hit you, and then it throws you off balance, and you're wondering how.
Now, if my son was feeling like this, I wonder what the children of this woman would be feeling. Some of the children might not really like what their mom is wearing.
That's another point.
They wouldn't know how
they don't know how to say it. You're right.
Yeah, I think the best way is for schools to step up and do something about this. If not, most of these women will never change. All right, we'll go on a short break, and when we come back, we'll introduce our guests as well as our topics. Stay with us. We'll be right back.
No matter what I see, enough fit make mouth heavy to talk am. That's now why people they talk.
You know what they worry you, but you know go fit help yourself.
In this kind of situation now, what if they really no talk to Ona? What will be the way forward?
They go bury our chairman on Thursday. We go remain here.
Make we talk good where we they see good, and where we know say we not they see good, make we also they talk am.
No woman, no mother deserve to know the grave of his child.
The bank manager, the bank executive, they are the one the government should first face.
People They Talk, the show on Monday to Friday by 5 p.m. on top ADBN TV.
Welcome to the Niger Delta, a region of incredible beauty and stark contrast. From its breathtaking landscapes to its rich cultural heritage, this is a place where history and modernity collide. But beneath this serene surface lies a story of struggle and resilience. The Niger Delta is the lifeblood of Nigeria's economy, home to vast oil reserves that fuel the nation, yet it is a land where the people fight for their share of the wealth. Join us on the program Niger Delta Today as we explore the heart of the Niger Delta, discover the vibrant cultures, the struggles for environmental justice, and the stories of the people who call this place home. This is the Niger Delta, a land of contrast, a story of resilience, a journey of hope. Don't miss our exclusive series, Niger Delta Today, every day at 12 noon, only on ADBN TV. Witness the untold stories, experience the journey, be part of the change.
It is Groovy Mono, aka the Steve Prince.
Yo, what's up? It's Big Shags. I'm in London.
Hey guys, I'm Princess Jekoko. My name is Mutale Mwanza, the Queen of Zambian Media.
My name is Grand Prince iTech.
Hi guys, my name is Baj Adebule. I'm an actor and a filmer.
Hello guys, I'm Falagade Banks.
My name is Kelechi Amadiobi, photographer, storyteller.
My name is Lanradi Dura, I'm an actor.
My name is Chidi Mokime.
Hi, my name is Uche Uba.
It's Tobe season.
I'm Miss Thames.
Hi ladies and gentlemen, boys and girls, mamas and papas, I am Jimmy. You can call me the entertainer.
My name is Esio Dometa. I am an actor and a film producer.
My name is Sobi Kuvana.
Hi. My name is Julius the Genius. I would give a shout out to ADBN.
Big shout out to ADBN TV.
You're watching ADBN.
And you are watching.
Keep watching ADBN TV.
And this is ADBN TV.
And this is a shout out to ADBN TV. Keep watching, don't switch the dial.
Shout out to ADBN. Keep watching, love.
And you are watching ADBN TV.
Shout out to ADBN TV.
I've got one thing for you. Make sure you keep watching ADBN TV.
And shout out
to ADBN TV.
Shout out to ADBN TV. Don't touch that dial.
And you're watching
ADBN TV. Keep watching ADBN TV.
And I'm shouting out to ADBN TV.
They're watching ADBN TV.
Keep watching ADBN TV. This is where to be. And you're watching ADBN.
A shout out to
ADBN TV.
And shout out to ADBN TV. Keep watching.
And you're watching ADBN TV.
Keep watching ADBN TV.
Right now you are checking out ADBN TV. One time.
ADBN. Keep watching. I love you and kisses.
Keep watching ADBN.
And a special shout out to ADBN. Keep doing what you're doing, guys. Please don't touch that dial.
Stay groovy.
Hey Bobby.
It's a shout out to ADBN.
ADBN, Advocate Broadcasting Network.
All right. Welcome back and thanks for being there. So today we are shining a light on spina bifida and hydrocephalus, a condition that affects millions worldwide. So joining us is Dr. Ubong Ekpene, a leading expert in neurosurgery to share valuable insights and expertise. All right, doctor, today I'm giving you the stage. Take the stage and educate us on this.
Yeah,
because it's not a popular kind of
sickness.
Yeah. So we need to know more about it. So
everything about it.
Exactly.
What it is, what to expect.
Yeah.
Everything.
You're welcome to the show, doctor.
Okay, I hope time will permit everything.
We hope so. You're welcome.
So
in simple terms, if you don't mind, break them out in simple terms.
Okay. I think we'll start with hydrocephalus.
Okay.
So hydrocephalus comes from two Greek words called hydro, which means water, and kephali, which is head. So when you combine the two, water head, it means that there is abnormal accumulation of water within the brain or within the head.
Okay.
So it's a clinical condition where there is accumulation of a particular kind of fluid we call cerebrospinal fluid. Now let me break that down. Cerebrospinal fluid is produced in all human beings. It's a normal physiologic fluid that is produced in all human beings. Now it is produced, it is transported within the brain, and then it is reabsorbed into the blood. And that helps the brain to function properly. So but when there is a problem with that normal physiology, either there is overproduction, which is not commensurate with the reabsorption. It can lead to abnormal accumulation, resulting in the child's head becoming big.
Like we have on the
what
screen.
You can see on the screen there. The child's head becomes abnormally big. And because the water itself is not being reabsorbed sufficiently, sometimes there is a problem with the flow. So it is produced normally, but there's an obstruction to the flow. When there is an obstruction to the flow, it also will lead to accumulation. And then lastly, there could be normal production, no blockage in any conduit where it flows, but there's a problem at the reabsorptive end. Remember I told you it is produced in the brain, it's reabsorbed into the blood. So it is like a cycle that must be maintained. So when there is a problem with reabsorption, all of those processes, overproduction, problem with flow, or problem with reabsorption, any of those, any condition that can lead to any of those abnormalities would result in accumulation. And when it accumulates, it's like a tank that water is flowing in and it's not exiting. As you keep pumping in, one of two things would happen. This tank will have to expand to accumulate the water, accommodate it, or it will burst. So that's what happens to the head. You notice in children who are babies, because if you touch the head of the baby, you notice that particularly the front side is soft. Sometimes it's be pulsating. And people will say it is breathing. So it is breathing because it hasn't fused. If you touch that of an adult, the skull itself is so fused. There is no point that is soft. So because of that ability of, or that fact that the child's head has not fused, when that water accumulates, to relieve pressure in the brain per se and keep the child alive, the head starts getting big. So you see children who have, like the one you just showed on screen, who has abnormally large head. Now, that abnormal size of the head as a result of accumulation of that special kind of water we call cerebrospinal fluid is what is called hydrocephalus.
Hydrocephalus.
All right. Now, the other condition too is spina bifida. Spina bifida comes from two words, spine and bifid. So it means that the spine is not fully formed. So instead of the spine being one tube, it becomes something like that, and like an opening. So, and sometimes you notice a swelling on the back. And that is because the spinal cord, during the period of formation, had a problem. And what was the problem? Instead of the spinal cord forming a tube as is expected, it at certain point stopped fusing and so remained open to the outside. And the problem with that is that the water that is supposed to surround it, the cerebrospinal fluid, now bulges out with the spinal cord. And you now notice the child has a swelling on the back there. Now, it is not just bulging out with the spinal cord. That particular spinal cord, because it hasn't developed as it should, it means its function also will be hampered. And so the child will grow up with certain problems which we will talk about. Now, so what is the cause of this?
Exactly, because I was about asking that.
Yes. So hydrocephalus occurs as a result of either a congenital problem. Congenital, that word means it was present at birth. The conditions that caused it were present at birth or while the child was in the womb. So the child came out with the problem already there. While it could also be acquired. Acquired means the child was born normal. Child came out, everybody was happy, celebrated. Down the line, something happened while the child is now out of the womb that triggered a process that resulted in any of those things we said. Overproduction, problem with flow, or problem with reabsorption.
Okay, what are those things that you really want to know?
Exactly.
That could trigger.
What action or inaction
so
could
in the womb, the child could have certain conditions we call congenital conditions like aqueductal stenosis. It just means that there are tubes within the brain called ventricles, and they are channels through which they flow. So along the channel, there could be narrowing and sometimes complete closure of that lumen where the water should flow normally. And because of that, the water stays there, accumulates, and the head starts getting bigger in size. There are many other conditions which I wouldn't want to because of the big name, than the Walker malformation, anal carry malformation. All of those are big terms which I shouldn't bother you with. But the one that is of relevance is the one that can occur after birth. A child who has meningitis that either was not properly treated or got complicated despite treatments, when the meningitis resolves, it should have left some scarring within the lumen of the brain, of that ventricle.
Okay.
Those narrow parts, either they adhered together, fibrosed, and then narrowed the flow, narrowed the opening so that the normal flow of it is not. Or at the point where the water is supposed to be reabsorbed into the blood, it causes some changes that makes the efficiency of that absorptive capacity reduced or completely destroyed. And so the water now accumulates. And when the water accumulates, it results in that. Another condition could be a tumor. A child who develops a brain tumor. The other time we discussed brain tumor. So a child can also develop brain tumor. If the brain tumor grows in a place or in a location in the brain where it compresses one of the narrow lumens where the water flows, then it can also obstruct and cause failure of flow, which we call obstructive hydrocephalus. A child who has had a head injury, either while the child is going to school or at home, or a child at a point of childbirth, if there was difficult labor, obstructed labor that eventually went through, the child's head was traumatized, bled into the brain, that itself can trigger this condition called hydrocephalus if the blood blocks any of those narrow lumen. All right, so there are many other conditions that can predispose to development of these hydrocephalus in the womb and outside the womb. Now, for the spina bifida, there are several other conditions that could predispose to these two. The most important being a condition called folic acid deficiency or folate deficiency. Most of our food in Africa does not have sufficient quantities of folic acid. And so women who have folate deficient tend to have an increased risk of having children who develop this condition. Why folic acid is so important is that it is a requirement in the development of the brain and spinal cord. It's a requirement. So if at the time of conception you don't have sufficient levels of this folic acid, then that child stands a risk or has a chance or stands a chance of developing this condition. It's not in all cases, but the risk of those whose mothers are folic acid deficient compared to the general population seems to be or tend to be higher. And so the problem is this: because our regular food does not have enough folic acid, that is why any woman who is planning pregnancy or is of childbearing age planning pregnancy, is good for you to take folic acid supplements. And that's why mothers who are on antenatal, they are prescribed that. But the problem with that is this, that development of the brain and spinal cord begins as early as the 3rd week, towards the end of the 3rd week of gestation.
Wow.
So it means that when the egg and the sperm fuse together to form the zygote that eventually will lead to embryo, fetus, and the baby, at day 18, the process has started. At that time, most women are not even aware they are pregnant. So it's after their first missed period. They'll say, maybe it's malaria, maybe it's stress, maybe I think, and then they wait the second missed period. Then they say, something is wrong. They now go to check and they're pregnant. But at that time, that's almost 6 weeks. And the beginning of the process is about 18 days of gestation and stops at the 27th or 28th day, between 26th and 28th day of gestation. That's 4 weeks.
That's serious.
So it means that
if you don't have the
if you don't have sufficient levels at the time of conception, it's very unlikely that you have that protection.
And the problem is, even when most women discover they are pregnant, they wait till 3 months before going to register for antenatal.
Yes.
And it is during this process now they begin to take this folic acid.
At that time, you've missed the boat. So it's really so that's.
Now let's talk about the diagnosis and the symptoms. You know, how do we get to know these things when we see them?
So these conditions are, the good thing about it is that it doesn't need highfalutin investigations, imaging investigations to decide somebody has that. A child is born and the child has a big head, abnormally big head. You know that this child has that condition.
As the child is born, would you notice the size of the head?
Okay, so during antenatal care, women usually do routine checks, including ultrasound scan.
Exactly.
So during that ultrasound scan, it could be picked up that this child's head seems to be
unusually big.
Yes, out of sync with what is expected for that age and probably the gender. And so they can suspect, and with follow-up over time, with repeated ultrasound scan, the doctor can for sure know that this child's head is abnormal. And of course, you can also pick up at that time, and the mother can be advised, this child's head is not going to be able to pass through your birth canal. So you can be delivered of this child using the cesarean section. So in utero, it can be diagnosed. For those who don't go to antenatal care, of course, those ones probably end up in churches or other places where they could be delivered of the child. So they can have problem with labor. They be obstructed because the child's head is rather too big to come out. And they eventually end up in the hospital and it's discovered and they end up still undergoing it. But the key thing is that at birth, when the child comes out, you will notice that the head is unusually big. And so it's a clinical diagnosis. But in utero, that's within the womb, ultrasound scan can help, and even an MRI. For the spinal bifida, it's also a clinical diagnosis. The child comes out, it may not be possible to pick it in utero as while it's still in the womb. But of course, I'll talk about that. It can also be picked up. But when the child comes out, it should be noticed that there's something abnormal about that child's back. So that brings us to what are the types of spinal bifida. So we have the types that are actually obvious, like the one you posted. We call spinal bifida cystica. You'll see a cyst, like a swelling. And there is spinal bifida occulta, occult, secret.
That one is not obvious.
So it means that one is not very obvious at birth. You may just see a dimple, like, you know, dimple, people who have dimple on their cheeks and all that. So you can have a dimple on the spine there. That may just be the only sign that there is something ongoing there. Or a tuft of hair, a hair on the spine. You don't expect that someone should have hair in the middle of at the back, midline. So that you find a tuft of hair there, or abnormal pigmentation. That place is darker than the rest of the skin, or it's more reddish. Like it's not just birthmark will be small, but yes, you can have a larger. You see, it's large, so that tells you that there may be something going on there underneath. So it's occult. You can't see it. So most times the occult one may present with problems much later, but the cystic ones are the obvious ones that present with problems ab initio, that's from the beginning. So the child is born, depending on at what level of the spine that is involved, the child may present with problems with walking. So the legs are paralyzed. Sometimes the legs, several aspects or parts of the legs are weak, while some cannot even move. And then sometimes the child may have problem with feeling, sensation in the legs. May have problem with controlling urine as the child grows. May have problem with controlling stool. And the other problem that the child may develop, if it's a male, may have erectile dysfunction. Sometimes the problems with the musculature can cause that child to have what is called club foot. Yes, you see some children that their feet are not, they grow up and it's not like the normal shape of the foot of
all right,
people
doctor. And let's go on a very short break, and then when we come back, we'll talk about the treatments for this. Stay with us. We'll be right back after this short break.
No matter wetin I see, enough fit make mouth heavy to talk am. That's now why people they talk.
You know wetin dey worry you, but you no go fit take help yourself.
In this kind of situation now, what if they really no talk to Ona? Wetin be the way forward?
They go bury our chairman on Thursday. We go remain here.
Make we talk good where we dey see good, and where we know say we not dey see good, make we also dey talk am.
No woman, no mother deserve to know the grave of his child.
The bank manager, the bank executive, they are the one the government should best face.
People They Talk, the show on Monday to Friday by 5 p.m. on top ADBN TV.
All right, thank you for being there. So we are still discussing SPH. I had to shorten it. Okay, so doctor, you were to say something. Before we talk about the treatment available for these conditions, let's talk about how what mothers can do to actually prevent this kind of condition.
And yeah, if it's also hereditary, you know.
Okay, all right. So yes, so there are some conditions that are hereditary, like at the hydrocephalus, there are some hereditary type, we call it the X-linked type, which is seen in males. You don't find that condition commonly in females. But otherwise, it is mostly as a result of conditions that happened while the child was in the womb. There are certain diseases that the mother can have that can predispose the child in the womb to develop that, like some infections, like toxoplasmosis, like what we call rubella. It's a type of viral infection. Herpes simplex virus, viral infection. These are all infections that can predispose the mother to develop that condition. Also, mothers who smoke, mothers who drink alcohol a lot during pregnancy can predispose to developing those conditions. A mother who is on certain drug, like anti-epileptic drug, like carbamazepine or valproate. These are drugs that are taken for seizures. If a mother has that condition and is taking it during pregnancy, it can predispose a child to develop spina bifida. We've talked about folate deficiency, and there's also certain chemicals that a mother can be exposed to, that like lead, that is used to produce some roofing sheets, like asbestos and some other lead equipped tools and all that. If a mother works in such industries, may be predisposed to having that while pregnant. And there are many other things that can
predispose one to having
having that during pregnancy. Even mothers who do this, what do they call it? This bath.
Sitz bath.
Not sitz bath. Those who
sauna.
Sauna, yes.
Sauna bath.
Yes, the heat. Yes.
Oh, really?
Oh, sure. During pregnancy, yes, can predispose to that.
Wow.
So if I want to go on listing it, we can go on and on.
and it will help so that we could also
we could
be
know,
aware,
because some of these things women just do them without knowing the implications of it.
Yes, so during pregnancy you must check with your doctor, your gynecologist, obstetrician, what you should do and what you shouldn't do during pregnancy. Because
so
those things can impact on the life of the baby growing inside.
All right, so now let's go over to the treatment.
So when it's been diagnosed, if a child is diagnosed to have...
Does it have to always end in surgery?
Well, for the spina bifida occulta, because it's occult, I mean, you're not worried about certainly. You just have to follow up the child. And as long as the child doesn't have neurologic dysfunctions, weakness in the legs, all those abnormality, you just follow up the child over time and see. At the earliest sign that something is going wrong, then you intervene. But for the obvious ones, the occulta, like the one you're showing, it needs surgical intervention. For the spina bifida, it can be repaired. And if it is repaired in time, some people in some countries can repair it while the child is still in the womb.
Oh, really?
Yes, so there are some
technologies.
Yes, so surgeries that can be done while the mother is pregnant. And that can reduce the neurologic effects that the child can have at birth. It also can reduce the tendency of the child to develop associated hydrocephalus.
Okay.
Because the child with myelomeningocele or spina bifida can also develop hydrocephalus even after treatment. But the risk is reduced if the surgery is done during pregnancy.
Okay.
Of course, that also comes with some risk. Some of those patients may also develop spontaneous abortion following the surgery. But those whose surgery are successful, there's reduction in risk of development of hydrocephalus and also an improvement in or reduction in the risk of developing all those neurologic deficits we're talking about.
Okay.
All right, so now for hydrocephalus, so myelomeningocele can be repaired. And the reason why it is repaired, the one that is the spina bifida, that is obvious swelling, is that if you don't repair it early, it can rupture spontaneously. And if it ruptures on its own, it can, of course, cause the child to develop recurrent infections and can even lead to death. The water that comes out is what is coming from the brain too.
Okay.
And the child can actually lose all that water and die as a result of that. So you don't want to wait until that happens. That's why.
You know, I wanted to ask, like the picture we just saw before this, the big head. What chance does that child stand? What are the chances for survival after the surgery?
So for this type of child, the child's head is already big. Surgery can be done. But you see, the problem with this head size is that it will take many years before this child's neck can be strong enough to support that head for the child to be able to sit, control the neck, sit, stand, and walk. So the risk of delayed milestones is very high in that child. Now, for the head size to grow to that size too, the brain itself must have been so compressed that is so thinned out, almost like paper. I know it is the brain that is required for all the developmental functions in the body. So if the brain itself has been marginalized, permit me to use that word, to the point that it barely exists, then you expect that the child's ability to be intelligent, ability to grow normally like other children will be seriously impaired.
Wow.
And so what that means is that for such children, can still be intervention can still be done. But of course, we explain to the mother that this child, the chances of recovery is very, very slim. That child may not grow up as a normal child. That is why it is best for intervention to be done when it is early. When we see children like this, I mean, they've missed the boat. If we intervene, it's just to give you some psychological comfort to the mother. But the best intervention is if it is diagnosed in time while the child is in the womb. So as soon as the mother is delivered of the child, surgery is given to the administered to the child. And the child grows up almost as every other normal child. Some children with hydrocephalus, you intervene, they grow up to even get married, have children, have normal intelligence.
I was about asking, what's the lifespan when it gets...
They can grow normally if intervention is done in time. If we pick it up while the child is still in the womb, as soon as the mother is delivered of the child, within a few days, the child has the surgery sorted out. The child, as long as there's no complication, the child will grow normally. Marry, I have patients like that.
So is that a major... That's a major surgery,
right?
surgery.
But the child can have normal life. The key thing is early intervention. Same thing with the spina bifida. But one thing I must stress is that when the spina bifida, the child has developed neurologic dysfunctions already in the womb and is born already with paralyzed limb. There's not so much you can do about that. But of course, for cosmetic purpose, you have taken up, you can repair, and the child's back will go back to normal. No more swelling there. We talked about the risk of a rupture. You've obviated that risk by that intervention. And then whatever neurologic deficits that would have progressed, you have nipped it on the bud, in the bud. So because of that, that child cannot progress in terms of the dysfunction that would have occurred.
You know, before we talk about why this awareness is crucial, you know, I would like us to talk about, I forgot the question I wanted to ask. You know, when I saw that head now, I was thinking, after the operation has been done, because I remember one time I went to the teaching hospital, I saw a child just like this, but unfortunately the child has been abandoned by everybody. So the nurses there were just taking care of the child, and they were soliciting for help, people to come contribute money. So I asked one of the nurses. It was way bigger than, it was so big. So I was asking the nurse, what are the chances of this child surviving? And she told me once this operation is done that we will not even know anything, this boy had this kind of a problem. So you're telling me now that the chances of survival or living like a normal child is slim. So I was wondering why the nurse told me something different. Or could it be that she doesn't even know? So it's possible she doesn't even
Yeah, it's possible
know.
she doesn't know.
Okay,
Or she was just saying
so that's why I want us
to
to talk why this awareness is crucial, because I know so many persons do not even understand this. And the other time, sorry, I'm talking plenty because I really need to know. You talked about surgery being done into what? Intro when the woman, while the woman is pregnant, to mitigate it becoming big. Is there anything new in Nigeria we have, to carry out these surgeries, seamlessly, like from
while
what we
in the
use?
womb, when the child is in the womb, or outside?
No, even while in the womb or while the child is outside. Something new, something, we are in the 21st century. We should have technologies,
Okay, so not many countries have the capacity to, even developed countries, to carry out fetal surgery. That was operate on the mother when the child is still in the womb. So Nigeria, of course, doesn't have the capacity as for now. All right. So but for surgery after the child is born, many centers, including Akwa Ibom State, can do the surgeries very, very successfully, and the child can live near normal life. Of course, I've told you the caveat there is early presentation. That's the essence of this awareness. Don't keep the child. You are delivered of a child. The child's head is just abnormal in size, and you keep it there. You are hiding the child. You don't want people to see, and you pray and hope the child dies. The child will not die quickly. The child will not die. The child will just stay there and wait for you until the head becomes so big and embarrassing. You now look for help. And by the time you now look for help, the child has missed the boat. Because when you notice it, at the earliest time you noticed it, should have been the time to intervene. And that's the best time. But if the child's head becomes so large, the brain has been so thinned out that it can barely function, then there is really no intervention anywhere in the world that you can give to the child that will guarantee that child living a normal life. The child may survive for some years, but normal life is what we're talking about here. Because when you divert the fluid, the surgery is just to divert the water to another place where it can be reabsorbed. Since the normal process or the root has had issues, so you divert. I'm talking about hydrocephalus now. So you divert the water. When you divert the water, the pressure in the brain reduces, and the brain can, the child can sustain whatever function is left already. So depending on how badly the brain has been damaged, the child can survive for some years. If it is so badly damaged, the child may die. So, but the problem is usually the milestones that the child now has that will be delayed. Because what is required for you to maintain an upright posture is that you're able to control your neck. So if the head is so big that the neck is so small, cannot carry it, the child will be lying there for years until such a time when the muscles has developed enough to carry the weight of that big head. And that can take years. So you see a child who is 3, 4, 5, 6 years still lying on the floor, cannot get up. So that's why that must be taken into consideration. So this enlightenment is to get people to know those things are there. It's not a curse that you have such a child, but it's a thing that can be handled if the child presents in time. And healthcare workers, especially those at the periphery, those in the general hospitals, those in the primary health centers, those in other hospitals that are not teaching hospital, should know that services are available in Akwa Ibom State here to help such children. So if you see such a child, don't tell the mother, go and throw this child away. This surgery can only be done abroad. It's not true. It can be done in many states in Nigeria presently because we have neurosurgeons. So I'm a neurosurgeon, and that is our area.
Now that you said this, I wanted to know, can you share some, some experiences, some success stories you've had with such cases? To give somebody hope out there. You're not just saying it, you've seen it.
There are many patients that we've had the surgery done on them, and in Akwa Ibom State, you are the teaching hospital and at the Ibom Specialist Multi-Specialty Hospital. And there are many of them that are alive, and they still come to the clinic and they're doing well.
Okay.
Yeah, of course, some of them also may not be doing too well because their head was already big before they presented. And when the head is so big like that, I mean, you just have to follow up over time and until the child's milestones develop. But if a child presents in time and when the head size is still within normal or slightly bigger than normal, then that child stands a better chance at recovery and at growing near normal life.
Okay, so how recurrent, how common has this been, at least in our own client?
Well, I get to see about at least 1 or 2 a month. So it's, and those are the ones that present at the teaching hospital.
Okay.
I don't get to the periphery to see those ones who are delivered there. Some of them, they take the children home and don't bring to the hospital, especially if somebody whispers to them, oh, this child, I don't know, may call different names.
So you have myths around it too.
There are myths around it too.
Okay.
Some people believe that this child is a curse. This child, they may give it all manner of names, and then the mother will be discouraged, keep the child dies. And they are also, so because of that, I don't get to see the real extent of the problem.
Okay.
So, but in clinic, I get to see, at least in a month, I can get to see 1, 2, or 3 sometimes. Wow, sometimes they actually come in drips.
That's quite much in a month.
Oh, sure.
That's in a year. You'll be talking about.
So do you have a database? I'm curious. Like,
well,
what are the statistics like?
Well, if I talk about the statistics within the hospital, then we just presented at the department the cases we've seen over a short period, and from the records I had there, we had like 55 that we had seen, and we had some of them, they didn't get to have surgery, they absconded, but we did surgery for close to 40 of them, and over 30 something of them are still, being followed up, and they're doing well. So it's something that can be, and then the myelomeningocele itself also, you have children also who, of course, some of them, because of the location of the myelomeningocele and the damage that has occurred already, they may still have as a grow-up problem with passing urine and controlling urine and stool. But in terms of walking and all the other things, if the spinal cord was not badly damaged, after the repair, the child can grow up to live a near normal life.
Okay.
All right.
Okay. So what are some of the challenges you face in treating some of these conditions?
Late presentation, myths that we've talked about. Sometimes people see these patients at the periphery there, and then because of the myths surrounding this condition, they don't get to present to the teaching hospital. Sometimes the people who are even treating them or handling them or who took delivery of the mother may not be aware that there is, they may notice, of course it's obvious, but the problem is that they may not know that these children can be helped. So that's why, sometimes some people don't even know that there's a neurosurgeon.
Because you rarely have cases.
No, I do have cases, but it's only when they come to the hospital there. If I don't come out to the station like this and talk, people wouldn't know. I wouldn't make noise and go on the street. A neurosurgeon is in town.
No, but but for your kind of specialty.
Yes, it's not also very common.
Yeah, it's not common. So you might think you need to travel far and wide. So, but personally, what have you done to engage people to create awareness that there is a neurosurgeon, and for this particular sickness we're talking about, I feel more should be done beyond this. Like a one-on-one during antenatal, maybe going to communities to sensitize people that, look, if you have a child presented with this, there is help. Let them know timely intervention. And again, do we have facilities that could detect it just during the antenatal, before they put to bed? Okay, so I think at that, you need to do a lot of work.
Yeah, I agree. Now
driving
you're saying that it makes sense. Going to
rural
areas, exactly. And all that. Yeah, I do more public enlightenment on radio and television. When the 25th Friday, last Friday was observed as World Hydrocephalus Spinal Bifida Day. So when it's around that period, I go on air and give public enlightenment. But of course, I believe most people will not even get to see this.
Exactly. We have our audience. We have our audience though,
yes.
but for those at the rural areas,
so I agree that that's public enlightenment at the level of the general hospitals and the primary health centers is very crucial, because if they can have this knowledge, of course, they can know how to prevent it.
Exactly.
Like folic acid supplements.
Exactly.
And then, of course, the government also has a role to play. In some countries, some of the dairy products that they have, the cereals, they are fortified
with folic
acid. So indirectly, you are taking it. You know that as long as you are eating those fortified products, you know that you are receiving certain amounts that can keep your serum level within normal. So as you are getting pregnant, that also reduces the risk.
You know, you at the beginning of the talk, you said most of our food here do not comprise of folic acid, but those ones that do have these folic acids, do you by chance want to mention them?
No. Well, the fact is that it depends. Why I'm saying some of the food is because a lot of times, because of probably the economic condition or situation we are in, people don't eat balanced diet. If you eat balanced diet,
you just got me there, because I also know one of the reasons people would give for this, a child presenting with this, could be malnutrition. So they would advise the mother, go feed well, and the child will grow into probably.
But most of our leafy food, you know, we are rich with leafy food, and they have folic acid, right?
Sure, they do. Leafy foods, fruits and vegetables actually are very good sources of that. But the issue there is that a lot of times the kind of food that people eat is what they can afford. So it will be more of carbohydrates and whatever it is that can make their stomach, feel satisfied that at least they're taking something for the day. So the nutritive value or components is not so important. So because of that, and of course you know that people tend to have these are those ones in the lower hierarchy in the food chain in terms of their economic capacity. So those are the people that tend to have that. Those who are rich rarely have this kind of condition. So that is why I think it's a very good thing to go to antenatal clinics and then in all those general hospitals and all that.
So for the 25th, what was the theme? What was
discussed?
What were you?
So it's all about early diagnosis and treatments of these conditions. Like I've mentioned, it's something that can be diagnosed even when the child is in the womb, using the mother's blood, using fluid taken from the sac that surrounds the baby, using scans. They're all things that can be picked up in time. And if it is picked up, preparations are made early enough. As soon as the mother is delivered of the child goes in, has the surgery, and prognosis is better, outcome is better than a child that stays at home for a month or two and is brought with the head so big that your intervention is not as rewarding. So that is it. And then of course, but the most important thing is prevention. Prevention. And prevention, we've mentioned the risk factors. We've mentioned several other things that needs to be, the mother needs to do on her own while being pregnant. And of course, that folic acid that must be taken if you're planning pregnancy. I mean, of course, in this part of the world, people really plan pregnancy. It happens as an accident. So, but that is why women of childbearing ages who are sexually active, should take folic acid.
And should also check their level of. Is there a way of checking the level? So you don't have too much of it.
No, you can't have too much of it.
You can't have too much of it, right?
Yes, you just the regular ones we take. Well, WHO recommends 0.4 milligrams a day for women of childbearing age and all that, and 4 milligrams for those mothers who have had previous pregnancy that ended in a child having spina bifida. But the one we usually have, those small tablets, is 5 milligrams. So taking that, I mean, you're already covered because you meet all the
all right. Thank you so much, Dr. Ubon, for your insightful and educative talk on spinal bifida.
Pleasure is mine.
Eddie, I'm sure you've learned a lot because from the beginning of this, you were like, What exactly is this?
So much. Of course, ignorance, you know. When you don't know, when you're not well armed. But I tell you that, thank you, doctor. That's what I can say. Thank you for coming on the show, and thank you for this.
Thank you, audience.
All right. So much. What did doctor also, like in one word, speak to someone who is having this problem, either a patient or a family? Some words of encouragement.
So if you have a child who has developed this condition already, and the child is with you at home, hasn't been treated yet, I want you to know that that child can be treated. Just take the child to the neurosurgery department or unit of the surgery department of University of Yo Teaching Hospital, and your child can be helped. And then if you've been diagnosed with that the child already has either hydrocephalus or spina bifida while still in the womb, while still pregnant, you need to register with the teaching hospitals for antenatal care so that we can follow you up. So as soon as you're delivered of your child, a solution can be sought for that child before that child's head becomes as big as what you're seeing there.
Oh, that's great.
All right, and then most importantly, prevention. You've heard all the things we've talked about, prevention, how to prevent it. Folic acid supplements, avoiding those things that predispose you to having that child with that condition during pregnancy.
All right, thank you so much, Dr. Obon. All right, the doctor has said it all. Thank you so much for being a part of the show. I hope you have learned one or two things, just like we have in the studio. We'll see you again tomorrow. Thanks for watching.
Yeah, thank you.
Why did they write clinical psychologist for me there? And